And joining us now with reaction to the President's State of the Union, Dr. Mehmet Oz, the Administrator for the Centers for Medicare and Medicaid Services. Doctor, I think doctor's better than Mr. Administrator. Do you even want to be an administrator? That's almost a pejorative, isn't it? That's like a bureaucrat. Good morning. Thanks for joining us.
Good morning. I do get to use a scalpel periodically when we make these budgets, but, I got to say politics is a fairly bloody sport. It might be bloodier than heart surgery, so it's a good training for what we're up to now. Yeah,
that is a good point. One of the things in this world where affordability is always being talked about suddenly by the opposition, the President is very proud of what's happening with pharmaceutical costs and most favored nation, things like that. Should he be, in your view?
No, 100%, Joe. The President's been upset about this for a long time. He brought it up in the first administration, but this time around, we brought in some world-class experts, Chris Klump, John Brooks, and Hernandez, people who really knew the pharmaceutical industry and could go head-to-head with these $3,000 an hour lawyers who negotiate these deals. And instead of cowering in front of Pharma, we were able to do what the President was insisting on, which is a deal with a moral hazard created by an industry which is incredibly innovative, save lives all the time with wonderful advances in technology. But nevertheless, they were charging American citizens 3 times more on average than brand products sold overseas. Joe, even when they were made in the same factory, in the same bottle, even when they're made here in America, we were paying 3 times more. And so the President wants that stopped. He also wants innovation to continue. So we went at it. We got 16 of the 17 top companies on board. The 17th one's going to sign. And we'll be back in the Oval Office again celebrating the President's initiative to make most favored nation drug pricing a standard. But there's some gaps. The first big gap is these deals last through this term. We made them for this president. We want to make sure these deals are codified by Congress so they last into future generations. We also don't have all the companies. And if Congress takes action, we can get all of pharmaceutical companies, especially those based in other countries, to agree that they must sell their drugs at the same price across the world. We're not price controlling. It's up to them to set their price. But whatever they're going to sell the drug for in America must be the price that they collect from other countries.
You know, Doctor, if you weren't administrator of Medicare and Medicaid, you could have been involved with the FDA or even a biologics chief. I feel you could wear all of those hats. You've seen some of the controversy. I think we're going to have Dr. Marty Makary. We're going to have him on it. And Becky was talking earlier about this amazing CRISPR technology. But it all comes back to rare diseases and drugs and the way that we promote it. There's a piece in the Journal today that is kind of very critical of what's going on with the head of biologics. I'm just wondering if you can weigh in on what's happening over there with Dr. Prasad and Marty Makary.
Well, Marty Makary is a superb clinician, but he's also a superb commissioner for the FDA. He's making some difficult and brave decisions, but we've worked together already crafting mechanisms for us to get devices approved more rapidly. We have a great model at CMS that lets us pay quickly for some of these orphan drugs. Drugs, for example, like the ones that can cure, not just treat, cure sickle cell anemia. It costs us maybe $2 million to treat a child with sickle cell anemia, but it saves $10 million for the system. And more importantly, these children no longer suffer with these deadly complications of their illness. And so we're banking on these technologies getting advanced into commercial use, and we're going to pay for them when they get there. Folks like Marty Makary have to make tough decisions to make sure the standards are maintained. But across the board, this administration, and I do want to applaud Secretary Kennedy for this, he's bravely taking on the status quo. He's not just going to sit back and let what's been in place for many years continue without at least kicking the tires. We've done that with food policy. We've done that with some of the new ways we're paying for solutions, including, by the way, in Medicare and Medicaid. We're, for the first time, going to pay companies coming up with digital solutions if they get great outcomes. I'm going to say that again.
But Dr. Oz,
every major company signed up to participate.
What Joe was talking about in the Wall Street Journal, this is an op-ed piece that today lays out the difference with what Dr. Makary is doing, where he seems to be opening the path for a lot of these things, and what Dr. Prasad is doing, which seems to be rolling back some of those very same initiatives or very similar initiatives to try and help rare disease. And the Journal asked the question today, you know, where is this going? How do you have kind of one hand doing one thing and the other hand doing the opposite? You mentioned your support for Dr. Makary. What about Dr. Prasad?
I don't know Dr. Prasad, and I'm not trying to evade the question. I haven't read the article. I was busy watching the State of the Union address last night and getting ready for a bunch of different ways we're going to hopefully improve affordability in this country. My plate is plenty full at CMS without looking over to see what's happening next door.
Well, you're familiar with the gentleman, an ardent supporter of Bernie Sanders, government-run health care. It seems to stick out like a sore thumb in the Trump administration. Anyway, Doctor, I wanted to ask you about Becky. So what's the baby's name?
Baby KJ Mildew.
Baby KJ, CRISPR technology that allows it's working. Can you explain to me? Is it taken up by somatic tissue? I mean, it's everywhere. That would be an unbelievable advance if we could just put something in that would stay and work. You could actually alter someone's genetic makeup. Is that what's happening?
CRISPR technologies allow us to insert either changes to the DNA because they were defects during conception, or adjust other pathologies that exist. I'm very excited about the opportunity for these solutions to not make these diseases into chronic ailments, which require lifelong therapy, but rather simple or at least maybe even single solutions that might be able to get these kids past this problem. And I should mention, we were doing all these most favored nation drug pricing announcements in the Oval Office, and after one of them, we had an executive order on childhood cancer treatments. And about a dozen of these beautiful, bright-eyed kids were in the Oval Office. Every one of them would have passed if it wasn't for advances made by the pharmaceutical sector. So this administration is strongly supportive of innovation across the board, across our agencies. We want these technologies to prosper. We want to be able to pay for them as they're appropriately used. The key challenge for all of us is to make sure that we make these affordable. Because, Joe, 1 in 3 families, when they go to the pharmacy just for basic medications for chronic illnesses, are unable to afford their treatments. That's not right. That doesn't happen in other countries. So we're driving down prices for Medicaid. That's going to allow governors to manage their state budgets better. We're driving down prices for Medicare. That'll allow our trust fund to last longer. It'll keep the Medicare system intact. So folks who are working right now their entire life know that safety net will be there when they get older. And the president hammered on these issues last night, which is, again, why he's calling on Congress to codify some of these changes so we'll have it for affordability across the board. That includes drug prices, includes hospital prices, transparency, and what you're going to pay when you get sick. All of that makes the system work better because the market works better. And that's why we can now take a chance using AI and digital technologies to bring them to the forefront of solutions for the American people. Let me paint a picture for you. We're going to be able to give you, as a beneficiary, information that lets you live your best life. We'll meet you where you are. We don't have to get you to call 1-800-Medicare.gov. You can do that, too. We want to meet you where you are with tools and technologies from our most advanced companies in the space to allow you to deal with your diabetes more effectively, your hypertension, or maybe get diagnosed and treated with one of these CRISPR techniques.
It's too simplistic to say we'd like Europe's prices, but not Europe's innovation, but it's related. That's the thing. I mean, we're importing price controls to some extent. We just don't. We want to make sure that the drug companies are reimbursed for how expensive it is to develop these treatments, or else they won't do it, and we'll end up with no innovation. They got cheap drugs over there, but when's the last time they don't develop nearly as much as our industry does here, Doctor? I know that must be a front of mind consideration when we're doing all these things for you, is innovation.
Well, we're not. Yeah, Joe, we're not limiting their prices at all. They get to set their prices. We want to help them get better pricing in Europe. What they all come to us and say is, you guys are doing great. You support our innovation. Your cancer survival rates are better in America than in Europe because you're able to get access to these drugs faster. And so what we're saying to Europe is, you guys got to ante up. If America spends 0.8% of its GDP on pharmaceuticals that save lives, Europe can't spend less than half that. And we're asking Europe, like with NATO, same thing. NATO was an external threat. They all agreed to put in 5% of their GDP to protect themselves. We're demanding they do the same thing for an internal threat, the diseases that plague our people. Humanity will always be better if we invest in innovation, but Europe needs to carry its fair share. No more global freeloading. And you know what, Joe? Pharma wouldn't have signed on if they didn't think that made sense. And the sector's stock, their market cap has gone up since they signed these MFN deals, because they do allow us to preserve innovation while getting better reimbursement from other countries. Across the board, it'll be more stable for the industry.